Welcome back to Martino TV. You know, there are so many factors that affect whether you can have LASIK surgery or not. It's not just as simple as having bad eyesight and wanting to get it fixed. Things like allergies or really dry eyes can make your eyes so unhealthy that you cannot have that surgery. That's why Dr. John Dishler screens all of his patients so thoroughly, and he brought one of his patients with him this morning, Jennifer Bartos, this morning. Dr. Dishler, thanks for joining us. Jennifer, thank you so much for joining us this morning. So we were just discussing before we came on the air, you were looking, you can see it in the teleprompter, that you could read it, and you couldn't before, Jennifer.
Yes.
You know, before you had your LASIK eye surgery, we would have been a couple of blurry blobs to you, you said.
Very much so. Very much so.
And now you're seeing 20/20.
20/20, and sometimes I don't know if it might even be better than 20/20. It's pretty amazing.
Yeah. So we're talking about how allergies really can affect things and skin problems, and that was one issue Jennifer was dealing with when she came to you, Dr. Dishler.
Yeah, you know, we've talked lots of times and had different guests on who had their vision fixed and could see well, but today's point is that Jennifer, she went to another center. We probably shouldn't mention the name of the center she went to, I don't think. She went to another center. They were ready to sign her up and do surgery right away. She came to see us for a second opinion, and we have what we call smart screening, and I wanted to kind of go over that briefly. And when we screened her eyes due to her allergies and so forth, I have a scan here, and we took a scan of her eyes, and we said, you know, we're not really, we don't think we can do LASIK, maybe PRK, and so we said, well, you need to wait a while. We need to treat this. There's
what was
no
giving
rush.
you pause for concern? I mean, what was the problem?
Here's her scans, and I'll show you the before and after of just waiting and treating her medically. And without kind of giving you an entire education, there's this asymmetry here, and you can see that in this column here it says normal, and there's no normal. And this is the smart scan part. It kind of evaluates the scan, says, this is an abnormal scan. This eye does not look like it's ready for surgery, is the bottom line. And just after treating her, waiting, being patient, we didn't want to jump in right away. We did another scan. Let's see, this one was a few months later. And this scan showed now she was back to normal, has a nice normal pattern. And then we said, good news, we can do LASIK now. So we had to be patient, but we had to wait for the right time. So it's about doing the right testing, the medical care before and after, not just the surgery. Yeah, we've got the latest and greatest. I just got back from Chicago yesterday. Big international meeting. The American Academy of Ophthalmology was an invited lecturer, and we've got the best technology. There's actually hundreds of lasers like ours throughout the world. We're one of the few that have it right here in Colorado, but we've already talked about how great the technology is and all those things, but I want people to understand that you really need the good medical care along with the good surgical care.
Sure, that thorough pre-screening is what it seems like made all the difference for Jennifer, whereas, you know, the other clinic that you went to, they were going to jump in right away and do this, whereas you came to Dr. Dishler's and they went through, you know, what is this, 3 different types of screening we're looking at that you have names for here,
right,
the Atlas?
Right, and so the Atlas Pathfinder, that's a very sophisticated computer analysis, not just looking at patterns, but actually the computer analyzes the scans. Again, also from Zeiss, the eye profiler measures different things, the topography, the wavefront, and finally the Visante. I know these are all big words, but the Visante uses some special technology to measure the shape of the eye 3-dimensionally. So we look at all these things, it's all objective. The patient doesn't have to say, you know, which is better, 1 or 2, and we can get a very good idea as to whether the eyes are ready. Here's a picture of a patient having the scan. It's just light, takes a few seconds. So it's important to have the good technology and the good understanding of the technology before the procedure to get the very best results with the procedure.
Yes, this is definitely not your typical old-fashioned eye exam. You go through so many steps. And what I liked about this, as everybody, we've talked about this many times, my mom came to you. We flew her in from Oklahoma just to go to you.
Yeah.
And when she was going through that procedure, though they're so intelligent, the technology, I remember my mom being concerned that she wouldn't give the right answer or that she might mess up a little bit.
Right.
And you don't have to be so concerned with that anymore because the technology is so incredible.
Exactly. So the bottom line is get a good exam. You know, I tell people, come see us for a free, you know, screening, a free eval. We'll do all these testing. If you decide you want to go somewhere else for your LASIK, you know, that's fine, but at least you'll get our, you know, our analysis. And, you know, and the procedure itself was pretty easy. And
very easy. I was very nervous. I have to admit.
I can't imagine that you wouldn't be.
The day before, I was like, oh, what if something goes wrong? But everything was perfect. Yeah, I came back out, and the minute I sat up from the table after having the LASIK, I read the clock. It was pretty amazing.
That's incredible. And you're a school teacher, a music teacher, is that right?
Yes, I teach music.
So what kind of difference has this made for you in your career?
Oh, it's amazing. It's amazing. I can see my kids, for one. They're right in front of me, and they like to test me. They're like, Miss Bartos, what's on the wall over there? You know how many fingers I'm holding up. So
and you're passing those tests, aren't you?
Oh, I'm passing them with flying colors. Yes, it's pretty
incredible.
amazing.
And the staff is so wonderful there at the center. This is just an incredible. I mean, you don't just have the the office setting. I mean, from the reception to going back and getting the exam to people just really talking you through what to expect the surgery. That really had to help ease your mind a lot.
Absolutely. You know, we're in a certified surgery center. We're in over 7,000 square feet. We're state certified like a hospital. So we have the diagnostic office part, and then we have the surgery center part. But we don't have it set up like a hospital. It's very comfortable. We have a TV and lounge chairs and music playing to make people feel relaxed, to make the whole experience pretty quick and easy for people. And that's what we're about.
Very soothing and inviting.
Yeah.
So in that 3 months when Jennifer came in and you said, all right, she's not ready just yet, what kinds of things did she have to do to improve her eyes over that 3-month period for you to be able to do the surgery?
I had to go see my doctor, for one. So at first, was it Dr. Brownfield?
Yes.
Dr. Brownfield suggested that I go see a dermatologist. And she also gave me some steroids to help the allergy inside my eyes. So I went to see, I wasn't able to get into my dermatologist for several weeks out. So I went ahead and went to my doctor, and they prescribed a steroid, and that cleared it up for the scan that you see right there. And that's
what you want. You want that thorough.
And then the third one was going to the dermatologist, and then everything, when the day of surgery, was all clear.
Right. So this isn't, it's not like a doc-in-the-box LASIK center. We work with other doctors. We make sure if people have other medical problems, they get referred, get those problems treated by whoever, their primary doctor, other specialists, to make sure that everything's the way it should be up front. And we use some medications, to get her eyes soothed and calmed down. And then after that, it would have been a shame had we not been able to do LASIK for her, since she wanted it. And it was just, and some patience, sometimes it's just a matter of waiting long enough and not feeling like you have to do something right away.
Yeah, there's no need to rush.
There's no hurry.
All right, Dr. Dishler, thank you so much. Jennifer,
Thank
we
you.
appreciate it. We're going to tell everyone about the special offer that you are still offering from our 1-year anniversary, but it goes through the end of the month. The special offer was basically you're going to get $395 off of any custom all laser surgery. You also have financing, 24-month financing available, but you need to do this. Go ahead and make the call by the end of the month. Is that correct?
Right. Well, you can have the surgery after that, but you need to at least schedule your appointment by the end of the month to qualify. And this is a discount offer, already guaranteed lowest price for custom LASIK. So
absolutely. All right.
Yeah.
All right. Dr. Dishler you can reach him 303-793-3000, 303-793-3000, or Dishler.com. We appreciate it. Thanks so much.
Thank you.